open meeting. That grant was awarded to the health department under strict criteria, and it was for only numbers of patients seen and folks who were actually seeing patients and laying out hands on patients. It wasn't for paying for benefits. And every year, there was some allowance made to help the program move forward, but we were having to answer, it was a grant through the Office of Rural Health that had strict deliverable criteria attached to it, that was awarded to the health department, and VIM was a subcontractor executing the grant for us. The grant ran out December 31st of 2012, and when the grant ran out, it went away. So the clock stopped ticking on the grant went away. There was no opportunity to go back and back bill or create invoices that didn't previously exist. And that was handled through the finance person at the Office of Rural Health. We did the deliverables that the Office of Rural Health required us to do. We did the reporting requirements that the Office of Rural Health required us to do. And we did the financials, and we made sure that the financials that we submitted to Office of Rural Health were pristine and in line with the criteria of the grant. I don't know, that's all that I could say.
So, what you're saying, there really was no provision in the grant for benefits?
No.
For staff?
No.
Is that correct?
That's correct.
Okay. So,
what VIM did with their employees was their arrangement that they had with their employees. We had nothing to do with VIM employees. We just contracted back with VIM to provide the services, supplying their employees.
so then how do we get in the quagmire with the benefits for the staff? I mean, this had nothing to do with delivery of service.
Well, I don't know, you would have to ask Ms.
Okay, that's what
Kegley.
I'm asking, Ms. Kegley.
The previous 2 years, we had the same situation, Mr. Dunstan, and it went to the director of the Office of Rural Health, John Price, and John Price's response was, of course we expect you to pay benefits. That's what everybody should be doing. And the first 2 years, we did bill for benefits.
But it doesn't sound as it was on a up-to-date method. It seemed like there's a lot of backdating or going back and creating invoices, and if you'd done that the first year, it seems to me you would have learned from the first year to have it right the second year and third year.
The first year and the second year, we sat down with the accounting person at the health department, and we did go back over everything when we knew that how much money we were projected to have left over. She and I met to do that very thing a couple of months before the end of December, and the meeting did not happen as a let's go over the finances meeting. It became a really actually very ugly meeting. And from my discussions with the Office of Rural Health, they expected us to be able to bill for sick leave, vacation, and those issues that anybody would have for their employees. Mr. John Price is not there now, but he could certainly speak to that and probably would.
Well, any decisions that were made to pay above and beyond what the criteria of the original grant were given consideration by Mr. Price, and like Ms. Kegley said, he's no longer heading up the Office of Rural Health. So,
I mean, we have other grants with the Office of Rural Health. We've even actually just finished another partnership grant. Their grants are under great scrutiny, and we know that. But, to return $30,000 from this county when we can't provide health care, it's just wrong.
criteria of the grant was that we were required to return the unexpended $30,000.
But it's, just so you understand, it is our contention that it could have been spent. And it was used. I mean, it was certainly used. Could have been, I mean, we even had expenses that the year before we went back and billed for our computer system. I'm sorry. And this year, that last year, we did not bill for our computer system, but the health department billed for theirs. This grant was written, the health department absolutely was the lead agency, because if you write grants, you know that you have to have a lead agency. But it was a three-way partnership between the health department. It had to be a partnership to get the grant. You
The
had
only
to be
money that was allotted in the grant, though, was 2/10 of a medical director, a nurse practitioner, or a mid-level provider known as a physician assistant, a nurse, and I can't remember, maybe there was a front office person. I don't recall these, a medical assistant. And that's all it was. We priced those pieces out, sitting down with another rural health center to say, what do you pay these folks in order to work? Okay? So the prices for the positions for the grant were priced based on the usual and customary cost for the pieces. And then there was a computer system for the three-way partnership that was figured into the grant as well. And as we went through the grant, the original criteria was for the computer system that we originally went on, and anybody who's run a grant knows that without special consideration, the criteria of the grant cannot be changed, okay? The criteria stayed the same for all 3 years. VIM chose to go off in their own direction and to use their own computer system.
So you got your computer, right, off of the grant, is that correct? Dr. Chris, I'm asking you.
No, we didn't.
You didn't get your computer?
No.
Oh.
It was
Did
supposed to
anybody
be
get
for
a computer
the,
off of the grant? Did
well,
anyone?
I presume the VIM did because they went in their direction. I don't know, sir.
No, $810.
Well, it was your grant, right?
It was the health department's grant, yes.
So you don't know what the expenditure was for?
The expenditure was to put in place a medical office electronic records for adult health and for the VIM clinic. The reason being is that the system that was chosen was to communicate across the 3 agencies and to also communicate with Duke, who is our 5 or 6 county representative for community care in North Carolina. So the system
Did a
had,
computer system come with that?
pardon me?
Did a computer system come with that?
Come with what?
Did a computer system?
I hear what you're saying, but I mean, did a computer system come with what?
Well, you mentioned computer, okay?
With the grant?
Yeah, with the grant.
It was written into the
Yes.
grant.
In the
So I'm
grant,
asking you, did you get that?
Yes, we did.
Okay. So, but you didn't get one, you didn't get what you wanted.
we got one that was free, that was offered through the free.
No, I'm talking through the grant.
No,
you didn't-
through the grant, we did
So
not
now-
get
Yes,
it.
they,
you mentioned earlier-
excuse
We
me, sir,
did get
yes, they did.
computers, yes, we got
No,
computers.
they were part of the grant, and the system was there for them to use.
So, but you mentioned earlier, Ms. Kegley, that you didn't get the grant, that the health department got the computer, but you didn't get a computer. That's what you said earlier.
Yes, I did.
Is that correct?
Yes, that is
So-
what I
That
said.
is
So-
not correct.
Okay.
Well, let's put the names with the computer systems. eClinical Works was what we wrote into the grant to use as the system when we wrote the very first year of the grant. eClinical Works is a very good system. It's very well known. There are expenses, considerable expenses to eClinical Works. We were ready to go with eClinical Works. We already had the trainers scheduled. Then we were offered a free system with 5 years of support, which was also going to be offered through us as a satellite to the health department. It would have linked us, it would have had no expenses for 5 years. And so we went with the free system. When I talked to the Office of Rural Health and asked them, does it specifically have to be eClinical Works? And they said, no, it has to be a computer system. Now, the whole third year of the grant, the health department billed $810 a month for eClinical Works. It did not benefit the free clinic.
Let me just take this point to inform you, kind sirs and Madam County Manager, that it was through the reputation of Franklin County and the Franklin County Health Department and this health director that we got the grant. They gave it to the health department because they knew that they could be sure that the grant would be well administered. And the grant was it was not a small sum of money. It was $175,000 for 3 years. And as with all grants, because we have to administer state grants, if we come to the end of a grant year and we have not spent grant monies from the state, and a lot of times this is the case with the federal, any money that is not spent has to be reverted back to the grantor. So in this case, for the first 2 years, the Office of Rural Health allowed, because of this collaborative, for extra charges to be charged back to the grant that really shouldn't have been charged. The third year of the grant ran out December 31st, and when it ran out, it was gone. And we had not expended the $30,000, so we had to revert it. It's that simple.
It is not that simple, I'm sorry. It could have been expended.
We're not gonna argue back
Okay,
and
I'm
forth.
sorry.
Were you aware that there was any money left?
Was I?
Yes.
Yes, I was.
Okay. And you were aware the grant was running out?
Yes, I was.
So I'm still have a problem with all this backdating of invoices.
We wouldn't have been backdating if it would have been done. It could have been done before December 31st. We were meeting with the county manager before December 31st to discuss this.
I just want to
I'm
say,
sorry,
and
I'm gonna
I
take
really, for those of you who came to speak, those of you who are receiving services, who came to speak, I really feel sorry for you, because it sounds like to me that you're caught up in some bureaucratic quagmire as it relates to the grant. And when my feelings is that whether it's the health department or volunteers in medicine, it ought to be about delivering services. Now, and I'm sorry for you all who come to express yourselves, but it sounds obviously these people are not on the same page, and I think that's where our problem is. Now, I'm sorry. I just want to to say to these people, because you're the ones who are suffering as a result of whatever was $30,000 or what kind of computer it was. Because all that seems to me to be kind of null and void if people are not receiving the service.
Commissioner Lancaster.
I was just gonna say, I think we ought to table this, because I wanna do some research on this. I mean, something ain't right.
But before we make that motion, I'd like to ask the question, do y'all have a current audit? I didn't see one provided.
We had an audit, a full audit in 2011. Last year we did not. We did just a 990 with a nonprofit accounting specialist in Raleigh. We are having an audit this year. You know, audits are very, very expensive, and all of our grants are audited very, very closely by the Office of Rural Health, and that's where most of them are through. But we are having an audit. Actually, it's being done as we speak, probably.
Do y'all have any funding mechanisms that require annual certified audit?
No. No. We, like I said, we have an audit, we've had an audit every other year. And then in the other years, we've done our 990s.
Because I checked with the United Way board today and was advised that with funding that you received from United Way, you're required to have an annual audit.
Right, I got a call from Kathy today.
And the audit that you provided this year was a 2010 cover letter.
It was at 2011, but yes, it's right.
She told me 2010 year.
Oh, well, it's right on my desk. I got it from a meeting with Kathy today, yeah.
All right. So where was the current audit?
The 2011 is in the drawer. The 2012, we had a 990 done by a firm in Raleigh. And I can give you a copy of that if you'd like it, anytime.
Do you have a business plan?
Yes.
Okay. I mean, because what I see is a lack of a business plan. It looks like a lot of stuff thrown together. And I agree with Commissioner Lancaster that there's a whole lot more scrutiny needs to go into this. This is not about a $30,000 grant or $30,000 to get returned. This is, as Commissioner Johnson said, a lot of bureaucracy. The volunteers in medicine that I'm looking at are these right here that receive services that are coming back. I'm looking at 3 former patients that are returning as volunteers.
Absolutely.
85% of your budget is not about medicine, it's about payroll.
Yes.
And
And a large part of that was having a mid-level provider, which if you look at the amended budget, we do not have in there. We are actively recruiting for more volunteers. It's just, you know, we have a great shortage of doctors or providers here in the county. And, you know, so far we've had Dr. Stover and Dr. Blackburn that have been our volunteers for the last 10 years.
And I'd like, I think staff has had a chance to review this. Do y'all have managerial check?
I think the audit is certainly in order in light of the financial concerns that we discussed tonight as well as in the past. And that's one thing that Dr. Chris had emphasized was a sustainable plan, business plan, as part of the discussions that we've had. And I know that that was something that you were working on. So I think that's certainly a starting place to provide this board along with the business plan would be in order. An audit completed by an audit firm. What we saw today was an enrollment advisor cover letter, I believe, but we didn't have any audit that was provided for us.
Madam Manager, Mr. Chair, if I may, just one last thing too, is each year the grant monies have been going down in amounts because a lot of the money that the Office of Rural Health has been able to use to help different organizations has actually been from the Medicaid trust fund pot of money that they've had with the state separate from monies that pay Medicaid reimbursements. And of course that pot of money has been getting less and less, going more and more towards paying the Medicaid bill. So that's why for next year the health net money has been cut way down to a fee for service. So even though they say there's $40,000 allotted for Franklin County, it's, as I understand it, $50 per episode up to a total of $40,000. So they're going to have to get their Medicaid number and start billing to get that money back at $50 an episode. So
That too requires a certain infrastructure, and I think that business plan before getting into Medicaid, because if you didn't have the supports in place to do that accurately, then that could be even more problems for the organization.
Question for Ms. Davis. That just a few months ago when we did the budget, we allocated seems like around $8,600 to the organization. Can that money be used in this instance for matching?
We have already gotten that money, and actually it was used. So right now, only anything that comes in from, and that couldn't, because it's, well, yes, it could actually, because it's from the county. Anything that has to be from September the 1st that we can count toward the $30,000 match.
So as of right now, that 8640.
8640, yeah,
Yeah.
that we
So
got.
you think that can be used as part
It
of the
cannot be part of this year's $30,000 match, no.
September.
We got it before September 1st, so the only match can be anything that was donated from September 1st till we raise $30,000. That will give us the match.
We were too efficient on